Hey there. Welcome back to the podcast. We're continuing to explore the challenges and opportunities facing global health workforce development. My guests today are two nurse executives with long careers on the front lines of care who are now leading and influencing technology innovation with big companies who are reshaping care delivery. I sat down today with Kathleen McGrow, CNIO for Microsoft Health and Life Sciences, and Romina Elias, the CNIO for Dell Technologies. I asked them both to share their career stories, what inspired them to go into nursing, how they made their way into informatics and into the influential positions they're in today, and what technologies they're working on at Microsoft and Dell that have the potential to transform not only patient care, but nursing practice. And I asked them to share their advice to young nurses who are entering the profession around the world today. It was a great conversation. You won't want to miss it, so stick around. Across global health systems, health workers on the front lines of care delivery are carrying more on their shoulders today than ever before. Workforce shortages are increasing, scope of practice is shifting, and skill sets are definitely evolving. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Together, we're diving deep on the challenges and opportunities that loom large for recruiting, training, and equipping the health worker of the future. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by CGFNS International. Welcome back, everybody. I am joined today at the table by two thought leaders in the nursing space. Really looking forward to sitting down and talking today about their careers in industry and then what they're seeing in tech evolution and care model evolution and innovation for nurses and health workers. We talk a lot about critical shortage globally. We talk a lot about it here in the U.S. And workforce development, which we're focused on. So I'm happy to welcome today Kathleen McGrow from Microsoft, CNIO for Microsoft, and Romina Elias from Dell, also in a Chief Nursing Informatics Officer role. Welcome, guys. We're so glad to have you on the podcast.
Hi, Lea. Thanks for having me.
Thanks for having me, Lea.
Absolutely. We want to start out just talking about your careers. We have a range of listeners across globally, across our health occupations. The role that we play in industry is really focusing on career mobility, but also increasingly on career advancement and portability of skills and the roadmap for nurses and other health workers, how they start their careers, what those career opportunities are, where they go in the world to seek those opportunities and advancements, and where education and credentialing and increasingly the voice that nurses and health workers play in determining the future of healthcare and how healthcare is evolving. So excited to talk to you both about that. So let's start with the very beginning, as they say, and talk about your career journeys. What led you into healthcare and nursing? A lot of people have, a sentinel event or an inspiring story, or it's just maybe they're following a family tradition. So Kathleen, we'll start with you. How did you get into nursing? What inspired that decision as a career choice, and how did you get started?
Yeah, that's a good question. Thanks, Lea. Family. So I have, a family of nurses and, clinical folks, like respiratory therapy, physical therapy, et cetera. And my sister went into nursing, so I thought, she could do it, I could do it, which was really underestimating what my sister was able to do, right? So really for me, it was that easy of a thought around a career path. And I really just wanted to help people. I did not have any illness when I was a child. I know a lot of people kind of hook into that, but mine was definitely family and cultivated by my family. My mom was very excited that she had two nurses and respiratory therapists in the family at the time.
That's great. Romina, what was your inspiration for nursing?
So similar for me, it was also family. I'm Filipino, born and raised in the Philippines. So when we immigrated here in the States, my mom said, you got to be a nurse. Go into nursing. So I was initially hesitant. I didn't want to be just another Filipino nurse. So I went into computer science, but kind of found my passion. Like Kathleen said, wanted to help people. I had a niece who also went into the neonatal ICU. Initially, after birth, saw how great care had been delivered there, and tried my foot in nursing and ended up loving it. So for those who are hesitant to listen to their parents and to their moms, listen to your moms.
Listen to your moms. Great advice. So where did you start your career? And then we'll go back to Kathleen. Romina, where did that take you? How did you get started, and where did you go to school? Maybe that's a good question.
Sure. So I actually went into an associate's degree here in New York, Westchester Community College. Did my 2-year associate's degree, and knew that I wanted to further my education, wanted to get at least my bachelor's. And at that point, it was a new program that they were coming up from an RN to an MSN program for nursing informatics, which I didn't know what it was about. It was completely new. But I knew with my background in computer science, it had something to do with technology. So I figured if you can marry technology and, data science and healthcare, that's a win. So I went into the program again, completely loved it, worked for an organization that supported education, and then kind of blossomed from there and really loved how we're bridging healthcare, the bedside, and technology and innovation. So that's kind of how my informatics path started.
Kathleen, was that similar for you? I know when I talk to people in informatics, clinical informatics, usually it's because in frontline care, they've recognized the power and potential of data to transform care delivery. That seems to be a common thing that I hear. What took you down that pathway? Where did you start? Let's go there.
So I started similar to Romina, with my associates, but I did it for a different reason. I thought if I didn't like this in 2 years, I would know, because I would be at the bedside, right? We start clinical right away, and I could make my decision to pivot, but I did like it. So I ended up graduating after 2 years with my associates, and I actually started in an surgical oncology floor. And my sister, who was the nurse ahead of me, was like, you've got to get your bachelor's degree. And there was an RN to BSN program. So Romina's a little after my time. And so I went back to school and got my BSN in a rapid, short period of time. I think it was like an 18-month at the time. And it just kind of went from there. I think it's a very typical story. I went to my manager and I said, I really want to move to ICU after about a year and a half, almost 2 years. And she's like, I can support that, but we got to hire into this other position first. Well, that person left 4 months before, and I thought, she's never going to get me out of this unit. So I had to go to another hospital to work in the ICU, because I wanted to know absolutely everything about my patient. I wanted 2 patients to know everything about them. That was kind of my thought. And from there, after 2 years, I started doing agency and getting some other experiences. I did medical ICU, which is, I think, a phenomenal critical care unit area to start in, because you really are at the cellular pathology level of learning about disease, which I learned so much from the other nurses and the physicians in our unit. And then I actually was a travel nurse for 5 years before it was popular. I was one of very few people in a unit that was the traveler, and I did it for 5 years. I traveled across the country. I worked in California, Hawaii, New Orleans, a lot of different places, but I did it for the love of travel, and I wanted to see what it was like out there. And then I did a travel contract at home where I live in Baltimore, and that travel contract was at Johns Hopkins, and I ended up staying there for a period of time and then started applying for jobs. And I ended up, my clinical career was at Shock Trauma, University of Maryland Shock Trauma, the Trauma Resuscitation Unit, because I really wanted to work there.
Yeah.
I have a high adrenaline, a rush type of job. And my foray in informatics was a little bit different than Romina's. If you want me to tell you, I can tell you about that.
Yeah, absolutely.
So my foray was actually taking care of a patient at Shock Trauma in Baltimore. And we would we had a homegrown system called MCS, MIMS Clinical System, and we did command lines. So there was no computer EMR. There was no, really, you talk about data, Lea, it was very limited.
Yes.
And I would do 3.2.1 to get hematology and 3.2.2 to get chemistry. And I remember saying to my coworker, why can't I see this on one screen? And she's like, some blank engineers in the basement built it and never asked us what we wanted, Kathleen.
Yeah.
And I was like, I got to find these engineers and tell them what we need. And that was when I decided, it's our workflow. Why don't we have any input into it? And how things, it's a very torturous path, but you get there. But I happened to work 1 block away from the University of Maryland School of Nursing, and they had the only nursing informatics program in the country at the time. So I decided that I was going to get my master's in nursing informatics. So that's kind of a roundabout way of
So
telling you
you
how I got
touched
into
on the thing
informatics.
that I've heard quite a lot, and actually you hear it a lot in health tech. Historically, a lot of tech that has been built by solution architects and technology companies, with not necessarily the user in mind at times. And we're obviously seeing a transformation of that. You go to the HIMSS show now, and you see nursing-led and clinically-led technology innovation. But 20 years ago, when we were showing up at HIMSS, there was a lot of technology rolling out that had not been developed with frontline care, delivery. People sitting at the table saying, this is not going to work. This isn't actually going to make a difference, and you need the data to support XYZ. So I already had it on my list of questions to say how much of this was, driven by, I need to be at the table helping to make the nurses and frontline care folks need to be at the table at the front end, not at the pilot stage when things are being deployed in facility. And you think, wow, if you'd asked me in the beginning, I could have told you some of these things would have worked better this way. So it's interesting to hear you say that, that inspired you to say, I'm stepping into this, and you found a program to do that.
Well, I will add, I 100% have a seat at the table, have to be represented at the table. But remember, when electronic health records were coming out, it was, in the 1990s, before HIPAA even.
Yeah.
And, the organizations came in and they said, hey, we've got this new thing you have to use. It's an electronic health record. The one that I use, electronic medical record, actually, remember it was EMR first.
Yeah.
The one that we implemented when I was at University of Maryland it went out of business in like a year. So it was only like a year long. But I will say, and this is my personal opinion, and this is what happened in my unit, very busy. We would go out to a helicopter, bring the patient in, et cetera. They came in and said, we're going to implement this system here. And what we said was, you do what you got to do. We're here to take care of the patients. You tell us what we need to know. So in my opinion, now that I look back retrospectively over 30 years or, 25 plus years, we abdicated a lot of power at that time, but we didn't recognize how much power we were abdicating. So now here we are, nurses 25, 30 years later trying to get the reins on that power. And with power comes a lot of knowledge, or with knowledge comes a lot of power, and vice versa. So now it's difficult to take that power back and to say we want to be a voice at the table. So we have to really collectively, I believe, raise our voices so we can be heard.
That's interesting. Romina, your thoughts on that?
I was going to say also, like, there was a lot of hesitancy to kind of adopt technology in the beginning. I remember as a brand new nurse, I was sitting in a forum with our CNO then complaining about having to do, having to onboard this new EMR, right? Or having to put in our notes on the computer versus on paper. As I look back, nobody was for it because we felt like we were taken away from the bedside. Yeah. We were wasting our time on the computer rather than, providing care. So I think that was one of the kind of catalysts as well to say why it was not designed for how we provided care. We took literally paper documentation and put it in an electronic format. Which is not, it doesn't fit, right? It doesn't fit into the workflow. We just basically put it on the computer. So I think it's a lot of work now to undo that, and to undo how we traditionally had thought of documentation, especially for nursing, in now the digital age.
There were a lot of clunky steps to get there. My early background was in medical transcription and billing and coding. I think I shared that with you guys on a previous call. And I remember when we first went to digitized records, it was a head scratcher to me because they were bundled and sitting in medical records waiting to be scanned in as an image and not mineable or searchable in any way. And I'm like, we're not quite at digitization that we need to get. There were some clunky steps to get there for sure. And I'd love for you guys to talk about where we are now compared to some of those early growing pain stages where documentation, data integration is today, and maybe some of the work that you're doing with your respective organizations. Romina.
Sure, I'll start, and I know Kathleen has a lot more background on what Microsoft is doing as well. Leah, like you said, just because it's digitized, meaning it's scanned into the system, doesn't mean we're digital, right?
Yeah.
So I think one of the works that, and I think we have a lot of kind of work to do in that we have all of these technologies. We have, computer on wheels or workstation on wheels is a staple now for all healthcare organizations, but yet hospitals are still having issues with, Wi-Fi they can't access the system, or it takes forever to log into the system. There's a lot more work now and a lot more promising technology with private 5G kind of working and being able to kind of optimize the networking piece. And I know that there's, and I know we're going to talk about this later as well with the advancements in AI, being able to automate a lot of that documentation with your ambient voice and ambient listening. There's a lot of potential now, and there's a lot of capabilities, I think, with technology that we're going to be able to use, and we're going to be able to see in healthcare, and that's exciting. To me, for sure.
Voice is an interesting one, and we could talk about that a lot. Sometimes people get focused on AI, and as they should, and AR and VR and some of the virtual reality and extended reality capabilities. But the power of ambient voice to really be a frontline care tool and relief to health workers, I think, is sometimes underestimated. So that's an interesting one that you mentioned that. Yeah.
And I think there's a lot of work that we could do, because nursing and how nursing documents is not necessarily friendly for like a voice or a natural conversation type of a documentation. So I think there's a lot of work we have to redesign and reimagine really what that looks like for us to be really able to kind of harness the power of ambient voice technology, right?
Yeah.
But you are completely right. I think that's one of those things that documentation at the very least is something that we can certainly automate. In healthcare for sure.
Well, and it had to be fit into an EHR box for a while. Everyone had to think differently about the drop-down menus and the normals and the click-throughs.
The clicks,
all of the clicks, and then now to move to voices and as transformative as it will be. It's interesting that actually the way you think, document in your workflow has to change to fit into that now voice-enabled environment. Kathleen, your thoughts?
So, I mean, I can certainly talk about the ambient voice, unless you want to save that for later.
No, that's good. We're on it.
Okay, so the thing with the ambient voice, to Romina's point, is, if you look at how physicians document, it's a text blob, right? It's it's a SOAP note, right?
Yes.
And with nursing, obviously, we went from a paper flow sheet, as Romina said, to electronic flow sheet. And the flow sheet, there's a different background, right? There's a back end that's different than the text blob that's, the big SOAP note. So that does make it more complicated. Also, essentially, it's drop down, single select, multi-select, et cetera. So that makes it a little bit more difficult technology-wise, but it's actually doable. And I do think that we will get to ambient voice, frankly, probably sooner than we all expect. And I think it'll be a game changer for nurses. I think the change management is where nurses will struggle, like we struggle with everything.
Yeah.
Because I will confess, when I was a nurse, I was like, we always did it this way. That's a safety issue. That's a quality issue. Like, I knew the 3 buttons to push. So it's change management. And, I've talked to a lot of different nurse leaders across the country and actually global. And, I asked them about it. And there's this thing called narrative care, Kathleen, that we have better NPS scores. We have better patient net promoter scores when we do narrative care, which means you actually talk the patient through what you're doing with them. You take their right arm, say, hi, I'm going to take your right arm here, Kathleen. I'm going to put a number 20 Gelco in because I need to start your IV. And you kind of talk them through that. That was not how I worked as a trauma nurse. The patient came in, I did what I needed to do. I didn't necessarily talk through everything. So I think for nurses, the change management and how they're going to have to maybe articulate things for their as they go through their care. But when I talk to nurses, nurse leaders, they're like, we actually do that already in some of our units. We actually do it always in pediatrics because the parents are watching, so we're talking through it. So I do think that there are areas that, we just need to figure out what are the best units? What are the units that are willing to be innovative, that want to do the different technologies, that we think we can kind of, go in and do this change management? And then what's the feedback? And I think this, Lea, is to the point of the first question or the second question, which is really around nurses being at the table and saying what works in the workflow and what doesn't necessarily work in the workflow. And then how do we adjust the technology to what the workfall is?
Or what would be needed to get it there. Like you just gave, I think, a great use case for if you are a nurse or a nursing team already engaged in narrative care, then you're primed for moving into a voice-enabled environment, and you're already doing what's going to transformatively affect that. Whereas maybe that's the first step to getting to strong, accurate ambient voice and documentation capture is, let's just start with the behavioral or practice change of moving into a narrative care workflow. Like you said, if you hadn't done that before and some other units are doing it now, that training seems to me to be stepwise approach towards tech enablement. And it might start with workflow change. But to your point, there might be times when the tech needs to change to adopt to the workflow, but sometimes the workflow needs to change to enable the technology. It seems like you gave a good example there of the latter.
Correct. And I go actually back to the question, like the original question you had asked, for me, it kind of starts at the beginning of workforce and the issues that we have now. I feel very strongly that, especially during COVID and everything that we've seen with nurses leaving the bedside, retiring early, lesser experience at the bedside, lesser experience as managers, because I, talk to a lot of different organizations. I'm kind of hearing what's going on. During COVID, a lot of nurses did not do bedside clinicals. So much was remote. They went to school remote. They did clinicals where they could do them. It was very difficult to get them spaces. There's skill sets that necessarily might be required, delegation skills, communication skills, strategic thinking skills that they may not have been able to cultivate. And this is what I'm being told by organizations. So when the nurses are coming in, newly graduated nurses, there's actually a significant amount of just, I'll say those types of almost, like, I don't want to call it leadership skills, but, just regular skills that you would think of, knowing how to communicate and delegate, but you have to gain that experience. So they're trying to work with them to gain that experience. So I feel like don't let a good crisis go to waste. Let's, maximize it, get nurses the voice while we can. What do they need? What do we need to have, really competent and skilled nurses and proficient nurses at the bedside? And the reason why I tell my team why we should all care about it is that we'll all either be a patient or a family member will be a patient at some time in the future. And we want to make sure that they have nurses that have the tools and the technology as well as the skills that they need in order to do good quality, safe, effective care for their patients.
That is a powerful and important statement for our international audience as well. When we look at, the often disparity of standards and training globally around all of these health occupations. Kathleen and I were talking earlier about the fact, I can tell you, when I stepped into CGFNS, which was a little over a year ago, I was surprised that there aren't global standards for training or for credentialing, that doesn't exist. And that's certainly something that we advocate for, and coming up with competency frameworks that are not country specific, and having a skill set that actually can be moved from one location to another. But all of those things that you just said, then when you look at that on a global scale, that's rather daunting, but powerfully important, because we're not the only ones. The U.S. is not the only ones experiencing critical shortage, and having some of these issues of training and recruitment, and all of that trickles down because we're seeing fewer nurses stepping into nurse education, and that affects, the recruitment classes that are coming in. And as you said, COVID certainly had an impact on providing some of those softer interstitial sort of skills that you cannot acquire sitting in a virtual environment or doing some of your training virtually. So I think that was an important note for our audience. I'd love to stay on that topic of where where you see nursing education and training going, especially where tech enablement is concerned, since it's critical to not only our workforce here, but also, globally, how we're training and equipping nurse candidates and other health workers to step into these roles. Romina, any thoughts on that?
And it's such a great question, because it's like at the beginning, right? So it kind of, we're thinking the shortage is part of the reason is that there's not a lot of nurses that are coming in, and because we don't have a lot of educators as well. But I feel like the nurses that are coming in now, they also have a very different expectation as far as technology, right? They have little tolerance for, not quick and like frictionless technology, because that's what they experience.
They're digital natives,
in school, right? In their everyday lives. So they come into work and the computer is slow, or they can't, log in right away. That's also, I think that's also kind of fast forwarding and kind of pulling technology to where the end users are asking for it. And they're more vocal to say, this is what I need. Similar to Kathleen, I also speak with a lot of healthcare leaders and nursing leaders, and the same issues, right, for the workforce, but they have a lot more demands as well. Flexible staffing is a big thing now, too. We can't just, and I think all of it to say is there's a different mindset for the workforce now, and how we train the nurses that are coming into the industry also has to change, right? Yeah. So we have to incorporate technology into that. You spoke about, Lea, the difference in the global standards. And I certainly am for that. I recently visited the Philippines and kind of saw where they're training nurses in the Philippines to help support the staffing shortage in other countries, specifically for the U.S. And there's a big kind of technology and systems difference or gap that they'd have to kind of get used to. But I completely agree. There's certain standards, I think, that can be standardized globally, but there's also certain geographic and cultural differences that has to be kind of put into the factor. And I think that's also one of the things that needs to be accounted for when you're training new nurses into the workforce.
You've just articulated why one of the reasons we're doing this podcast and why we want to have this conversation for a global health workforce audience is we traditionally have focused on evaluating the clinical skills and credentials and training of folks who come through CGFNS to migrate their careers. But there's all those other job readiness skills, especially where tech literacy is concerned, that we are increasingly focusing on making those connections with our stakeholders and our applicants, because that's as important to their acclimation in their new health system roles as their clinical skills. If they've not worked in an EHR before, they haven't worked in an AI-enabled environment and data-driven tools at their fingertips, if they're not familiar with telehealth and remote monitoring and increasingly hybrid care delivery models, that's why this, I think, is an important conversation to say, it's increasingly clinical skills and career advancement important, but it's all of these other skills that are going to ensure that you have, acclimation and success and the ability to thrive and stepping into these roles. So I appreciate you touching on that, because I think that's important to our audience. I'd love for you guys to share as much as you can. I came from a tech company before I came here to CGFNS. I know there's always projects under development in tech companies that you can't talk about yet, but I'd love to hear what you're working on right now. That excites you, that you feel is transformative to frontline care and to nursing care specifically. Kathleen, anything you can share that you guys are working on or connecting to right now?
Yeah, I mean, it's not super secret. Microsoft's all about Copilot, and Copilots really are around just helping you be able to better perform your job, to help improve efficiency, and to really help you better manage your time. So I'm working actually with a lot of clinicians, especially nurse leaders, clinical directors, managers, nurse managers, where they're just in and out of a lot of systems all day long. And there's, like you said, Lea, it's a lot of data, and they're trying to wrangle the data, and Copilot really helps give them the ability to do that. We're training them how to write prompts. They work together in groups in their hospitals, and they share each other's prompts and how they work, and how they help manage their day. So I use Copilot every day. It's a huge time saver, and I use it to I was writing an article on artificial intelligence actually, and I used Copilot. I would go do my search for the different literature that I was looking for, and I would have Copilot summarize the article and then read through the summary and see, is this article that I really would want to include in my literature and for this peer review journal. And one was like all about urology and AI, and I was like, well, that's so niche, I'm not going to put that in. So I knew I didn't have to spend time reading that article. And another one was all about the new core competencies for nursing informatics. So I wanted to read through all of that, right? So I just feel like these are the types of tools that can really help us improve, be more efficient with the work we have to do every day. So I'll say that's one. We also working on some nurse retention solutions, which are essentially Microsoft Power apps that are built around things like competencies and orientation, and being there's a lot of policies and procedures in organizations, and they could be in many different places. Having the ability, again, you can use an agent. You could use like a Copilot agent. You could just search what policy you're looking for, which I think, given that we do have a lesser experience at the bedside, I have organizations tell me that they had a patient write on their HCAPs that the nurse used Google to search something, how to do it at the bedside. And, wouldn't it be better that you want to keep your nurses within your tenet of what you're doing, what your policy and procedures are? You've spent millions of dollars on this knowledge base, right? And, to help them find what they need to find. So I think that there's going to be a lot of tools that we're going to see that are really going to improve that efficiency factor for nurses, and really just bring them joy back to the care what they really want to do, which is patient care. Of course, we spoke about ambient voice. Won't say much about that, but you'll be definitely hearing more about that in future. It's an arms race, right? It's generative AI at its best. There's a lot that, a lot of potential. I will say, since I kind of went down the AI path, I will say I do feel there's a lot of fear, uncertainty, and doubt, and that it's our responsibility, Romina and I, of course, as nurse leaders, it's our responsibility to really help bedside nurses have some level of comfort with that, and that's going to be through education. So I think that will be one of the biggest things that you'll see coming from, many of the organizations, nurse leaders, especially organizations, nurse-led organizations where, we can help our bedside nurses feel comfortable with that AI that is being utilized, for whatever reason within their patient care.
And getting them from, I feel like we could have even a long deep dive on just that conversation with AI, and maybe we'll come back and do that another time.
Absolutely.
But you touched on something there that I think it's about shifting them into the perception, I think, and the fear too. Instead of, I have to use this, I'm empowered to use it. Empowering nurses, and anyone really. I mean, I work in marketing, and we're talking about all the ways that obviously we would leverage AI to do that. We've had a lot of conversations about how empowering it is to take your subject matter expertise and really understand the importance of prompt development with AI, that you're actually the one in the driver's seat there, and training that prompt creation is a critical part of that. And I think sometimes people are afraid to use it, or they try it a couple of times and they're not really sure how to use the prompt. But I've seen more and more instances, and once people realize how empowering it is for them to create prompts based on what they already know about that patient scenario or that disease or whatever it could be, they feel like they're driving that, and they're partnering with the technology to do that. And I think the more we can train people across industry, not just health care specific, I think we'll see more engagement with it beyond people creating cool graphics and and writing resumes. So it's really great to hear how you're using that, or how you guys are building that out with Microsoft. Romina, what are you guys doing over at Dell with AI and other tech?
What else are we not doing, right? I
Yeah.
think everybody's doing a lot with AI and tech, but particularly something that I'm very excited about is redefining what the patient room looks like, right? The smart patient room. And that could mean very different depending on the organization, right? Depending on their level of maturity in digital innovation. But really looking at the patient room as another tool for the care providers to provide that care, whether that's IoT sensors, whether that's whatever equipment is in the room, whether it's really capturing the data that's connected to the patient. So that you can provide that to the caregiver, whether that's leveraging computer vision for cameras and remote patient monitoring. So we're working with a number of partners and health systems in kind of redefining what that looks like for now, and also what does that look like for the future, right? With digital humans and digital assistants coming into play in healthcare, what does that look like? What's their role? What's that technology's role in providing care and in healthcare? Now, and is there a room for something like that to be assistance, not only for the care provider but also for the patient? So lots of definitely
Very
exciting
exciting things.
technology.
But I imagine if I'm listening, hopefully, to all of what you're saying, and I'm a young nurse, or I'm considering a career in nursing, or I'm internationally trained and looking to mobilize my career and advance my skills. Where do I fit in that future picture? So if I hear you talking about voice-enabled rooms and smart hospital rooms, and what do I need to be thinking about, or what steps do I need to be taking in my career so I have relevancy in that future space of care delivery that's real-time and data-driven and tech-enabled? Do you see that shifting training at the nursing level to enable people to be ready for that future tech space? Is it upskilling? How do we talk about relevance with people stepping into the profession now? Because I think it's important. That's where innovation is going, and care delivery will look different because of all that than it did 20 years ago. It needs to, but where do you see that shifting training, preparation, or someone coming into the field today?
So I'll start. I guess it's all three, right? Like you had mentioned, it's being training and being part, having technology and technology innovation be part of the curriculum for training nurses that are coming onto the field. It's also maintaining. So certifications is a big something that we highly encourage in nursing as well, and technology innovation being part of any certification or continuing education process. So I think there's this initial start of embedding that into the education program, and also there's also we have to also continue to train those that are already in the field, right? And technology changes so quickly that you almost have to do this on a continual basis, not just annually. I feel like it has to be part of the program or part of the process as you go about your shift. But one thing I also wanted to note is that I think there's also a shift in the demand where technology is frictionless and easy and adaptive, that it's almost like getting an upgrade on your phone. You don't need to get trained on the upgrades and what the features on the new phone, right? It's just intuitive.
It's happening in the background.
It's happening in the background. It's intuitive. So I think there's also a shift in the technology that we roll out and implement in healthcare where it's intuitive at this point, that our end users are able to adapt to it without having to go through extensive training. Not to say that that's not important, because I think it is, for sure.
Awesome. Kathleen, I know we're getting to the top of our time.
I would like to say that I think that if you're considering nursing, or if you're new to nursing, I would say that it's a phenomenal career. It's one of the best decisions I ever made in my life. And I have family members, that are younger than me that have also made that decision, and they've had very successful careers, but we all do very different things. I'm a nurse informaticist. My niece is a nurse educator. My other niece works in the forensics units. So very different. My sister, she works in the ER. So very different. So I feel like nursing gives so much different opportunity. There's so many ways you can go, and you don't have to decide and say, I'm going to be a trauma nurse right now, and then I'm there forever. You can change your mind. There's so many different things that you can do, which is what I did. I decided to go into informatics. And then just think of the technology should be a tool to empower you to, as a nurse, to, assist you with your job, which really is caring for patients, doing patient care, educating patients, being there, holding their hand, reassuring them, and then doing all the things that come with it based on whatever they're in their process for, whether they're an acute situation or whether they're a chronic patient that you're taking care of in home health. So there's just such a breadth. I just feel like it's really, I don't want to say it's endless, but it seems like it. There's just so many different opportunities, but you will encounter technology regardless of the environment you decide to work in. And to Romina's point, right? It should be seamless. You just embrace it. And, we're going to learn from your input. So maybe if you can reach out and find out in your organization or your company, where do you want to make a difference? Do you have feedback? Is there someone you can talk to? So I talk to folks all the time about like career path and what they can do to learn more. And I think really just education, joining an association that maybe is, common to what your specialty is, get certified. You get more credibility when you're certified. Can think about, do you want to continue with your education and get another degree? But I just think that nursing as a career, for me, it was the best decision I made. And I think it was really a great decision for so many of the people that I know that went that route. But we all go a different path, very windy path.
I'm so glad that you landed there, because my final question or statement was to say, it's a really good time to become a nurse. We've heard a lot about shortage and burnout and, all of the challenges, obviously, that are facing the profession and healthcare delivery as a whole. But I don't think there's ever been a more empowered time to step into nursing, where nurses have more voice in care model evolution and tech development and more career opportunities and career advancement opportunities and choices. I think it's a great time to do that. And you guys are both certainly an example of that. I know it's inspiring to our audience. You're sitting in levels of leadership and decision-making and influence that might not have been available to nurses 25 or 30 years ago. And it's an exciting thing for the profession to see. So thank you both for being here today and sharing that. I definitely wanted to land, and you landed right there, Kathleen, on the up note of we love our careers and we love what we're doing and the impactful things that we're doing. And you're encouraging others who are coming along behind you to take those same or similar steps and step into what is continuing to be an impactful, influential career choice and role in healthcare. Thank you so much for being here. Really enjoyed our discussion today. Excited to hear about all the things that your companies are doing to drive innovation in healthcare, not only for care workers and care providers, but at the end of the day, to elevate the quality of care that we're delivering and experiencing, because all of us consume that care as well as patients and as caregivers of our family. So thank you for everything that you're doing to lift that those standards and to continue to drive better care everywhere. Thank you so much for being here.
Thank you. Thank you so much for the opportunity, for sure.
Thank you, Lea.
Thanks, guys. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at cgfns.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.